Welcoming everyone to Coffee with Roma, simulcast Zoom, Facebook, and YouTube. Hello and welcome to all of our viewers and followers to episode 5 of Coffee with Roma. I'm Ananda Krupa, your host and moderator. We present to you discussions on insurance, health coverage, open enrollment, Social Security strategies, and various financial planning modules and life insurance plans. A big thank you to all of our viewers who are watching currently on Facebook or YouTube. CEO and founder of Affordable Insurance and Financial Services with over 16 years of experience in financial services. MDRT, a red jacket earned from National Honor Association, Court of the Table in 2020, and a wholesaler in financial services, wealth management, and tax-free guaranteed income and tax-free retirement. Welcome, Roma Pithadiya.
Thank you. Thank you for having this opportunity to share very important information, especially for healthcare is a very important, and I'm glad to hear you here to answer all questions, whatever my viewer says. Thank you.
We are so happy to have you. And we are here with our expert, Roma, to answer all of your questions during open enrollment and beyond. The health and well-being of millions of Americans remains our highest priority. Health insurance providers are committed to help prevent the spread of COVID-19, but a lot of times with open enrollment, we have a lot of questions. Open enrollment is that period of time each year when you sign up for health insurance or change your plan. If you don't sign up for health insurance, we learned this in our last video, during open enrollment, you probably won't be able to sign up for health insurance until the next open enrollment period, which is again at the end of 2021, unless you experience qualifying events, which again, we featured in our last episode. Now, today we are focusing on Know Your Network. Roma, our first question, how do I know if my doctor is in my network?
That's a great question. Let me tell you something. If we want to count ourselves as a healthy, then you can be have a wealthy. So healthy and wealthy is very important to the two sides of the coins. And on that point, if you want to stay healthy, wealthy, then you have to stay on healthy. So healthy, wealthy, wealthy, healthy, that is connected with each other. But would you understand? The health insurance is the most complicated system in United States. The reason is been so many changes during ongoing time, before Obamacare and after Obamacare. The Obamacare, another name is Affordable Insurance Care Act. That is getting complicated every day with the doctors and as well as clients. Doctor is also, and doctor has admin staff. They are used to be with PPO, used to be with easygoing, not to worry about what covered, what not covered, what we supposed to get permission from the healthcare association and all that things, or from insurance company approvals and all that thing. They are not used to. Now, its complication is being went up. The reason is being government system is now has a main part in the network. Everything is, people used to be, client used to be with the PPO plan. So, and like a one generate plan was a Blue Cross Blue Shield show for very familiar plan. And has a PPO, individual or group, doesn't matter, but everybody was getting to get a PPO. Now, when the Obamacare came into the picture after 2013, insurance health premium price gone up because of the system of the government has so many restrictions and mandatory, there is no pre-ex conditions and all that things, that increase the premium for the client. So now no more PPO available as an individual plan, only available on the work side. But the work side, the premium is itself going high, so employee don't want to sign up from the work side. The reason is being they don't care how much the employee paying their premium, but they have to pay themselves. Every paycheck, $100 is cutting out from their paycheck, no matter they are getting 500, 600, $1,000 a month, and $100 is being coming out of their paycheck. That is also hurting them. That is like an additional cost for them. So they don't want to sign up. So premium is gone up, so now no more individual PPO plan, so have to go with the HMO plan. HMO plan means they have to stay on in the network. In the network, now complication for the admin staff of the doctors, and so now they stop taking so many plans because of the complications to get paid. Doctors get paid, and claims and all that things is like a big hassle for admin staff, which is not used to be, not trained, well trained, how to claim, what to claim, and all that things. So that is all complications is creating more problems with the in network and out network. Out network is you not need to worry about, go to the doctor wherever you go, want to go to the specialist. You not need to get approval from the primary care and all that things. But now when the HMO come and mandatory HMO, people is seeking for PPO, individual PPO. Roma, I want individual PPO. No, that is not available in the market. No matter how much the premium you want to pay, but there is no PPO available in the market as an individual plan. Then you have to go through the group insurance. Then you have to go to the employer benefit and all that things. And then it's lots of paperwork. Lots of paper. They don't want to do the lots of paperwork. So they do not have a choice. There is a choice is been now limited, and they have to work out no matter what, like it or not, but they have to work out with whatever the upcoming changes from the government, from the system, and from the health insurance, healthcare, doctors, network, and so many other things. So they do not have a choice. They have to stay in network and have to follow the bills and paperworks and all that things. It is a very complicated.
Roma, I'd love to kind of focus on deductibles here. This is that scary number that a lot of us who are choosing our plans, what our monthly premium is going to be, what our deductible is. It's vital. So let's first kind of go over the terminology here. A deductible is that amount that you pay for most eligible medical services or medications before your health plan begins to share the cost of covered services. So for example, I'd love to kind of know what the difference is if I'm paying more per month, less per month, where those little hidden fees, those little hidden percentages are, that one number that you have to get to before they even start covering anything. Let's talk about it, Roma. Can you go over it with us?
Right. That's a great question, actually, because we have to understand how the health insurance work and how our health condition is. If our health condition is great, then nothing wrong to keep a high deductible. So if you keep a high deductible and you barely go to the doctor once a year or twice a year, then keep a high deductible plan has a low premium, which is we can affordable. Low, it says low premium, but overall the premium is being increased, the comparison with the past 6 year, 5 year. So people has a still client has a still in mind that, oh no, I used to pay this much of that. So the point is a deductible. How you are using, that's how you are using, because of it's your health. How many times you go to the doctor? Really, you need to go to the doctor? Do you have any issues going on? Do you know that very soon need to do the operation or something? And sometimes we don't know about the health wise because we don't go to the doctor, not at all. But if you keep a high deductible and whatever the one primary preventive care is being covered, make sure you use that so you know your current health condition. That's help you the next year. What kind of plan are you willing to enroll? Is that worth or not? Instead of scared about the health and scared about this COVID and scared about anything, and enroll in the low deductible and paying a very high premium for few months, and then cannot afford, and then drop the plan, and then uninsured for the rest of the year. All this hassle, it's better use high deductible if you are absolutely healthy. How do you know the absolutely you are healthy or not? Annual checkup has a preventive care is a free. So why not use high deductible, go to the complete your preventive care, and then see is something wrong going on or had a chances to go next year. Then you can go next year, can use buy the low deductible plan. But we do have opportunity. So high deductible, low premium, low deductible, high premium, which is how you can afford, how you can manage. This is all about. And so many times it's now network. In network has a deductible different, out of network deductible is different. So make sure how you are using. Not like just go to the doctor and specialist the way you want to. No, follow the primary care. Of course, they have to follow the rules and regulation, because now government puts so many regulations, so everybody has to follow. Client has to pay, and also insurance company has to follow, doctor has to follow, the admin staff has to follow, and everybody has to coordinate with each other. So all that things is very important. In network deductible, out of network deductible, and all that things is very important. The other thing is I can say that in network you find a doctor and deductible, and some reason you drop that plan and go to the another plan with some qualified events. Deductible begins again when you start a new plan. So first 6 months, you already use example $3,000 deductible. You already paid from your pocket. Now some reason that plan is been dropped. Now some reason you are enrolling another plan in month of July or month of August. Deductible start again with the new plan. That deductible cannot carry forward from one plan to other plan, one company to other company. They don't. So we have to be very careful about the deductible, how to use the deductible, how to stay in network, how to keep the plan, how to re-enroll the other plan, and all that things is a very important.
Roma, I want to talk a little bit about your copay. So does my copay go towards my deductible, or how does that work?
Yes, that's another great question. Copay never add in the deductible. Deductible only sorry, my mistake. Copay towards deductible, but office visit fee for doctors and specialists, that is not count as a copay. That is a count as your primary visit fees. But if you pay like hospitalized, become a hospitalized, and over there you have to pay 20% your deductible, portion of your deductible, then yes, that 20%, example, $100 or 150, that goes towards adding your deductibles. So yes, office visit doesn't count, but copay does count.
And lastly, I have one other term before we run out of time that I wanted to ask about, and that's coinsurance. What is coinsurance? We know what copay is. We've heard here about choosing our plan, but I've seen this terminology about what coinsurance is. Is that like the copay, or
yes, because they are just using the difficult terminology, but it is indirect, that is the same. But they are using the different terminology.
Some of the terminology is so confusing. And
it is.
As a consumer, I just don't know what to do. It's a very difficult situation. I want to make the right decision. Open enrollment's right around the corner. And I know that the decision I make this year is going to affect all of 2021 until the next open enrollment season.
And especially when the COVID is going on, we don't know how the how the vaccine will become. Is that vaccine is coming or not? Even we don't know anything. So health insurance is very important. Long-term care is a very important. Supplement plan is a very important now than ever. And for that, why not take advantage from the specialist who is already in their situation, already doing expertise in their own area? So why not take advantage to get the expertise advice with that particular help? When we have a cancer, we go to the doctor, we are going to the right doctor, what the cancer specialist, not with the eye specialist. We are not going to get advice from the eye specialist. We have a cancer, we are going to the cancer specialist. Why not in the health insurance?
I couldn't agree more, Roma. And that's why you are our expert. And we're here every single Wednesday and Saturday to discuss over coffee or tea, whichever you prefer, discussions like these. I want to thank you so much for joining us, and for all of our viewers and listeners. Again, you can contact Roma directly to find out an individualized and customized plan for you. 972-693-3315 is her phone number. You can call her directly. That's her direct line. And this is going to ensure that you get the right plan at the right time. Thank you so much, Roma, for joining us. And again, tune in, simulcast Facebook, Zoom, YouTube to Coffee with Roma every Saturday and Wednesday. Thanks for joining.
Thanks for having this time. Thank you. You have a good day.